My name is Michelle Lessons. I am the Outpatient Mental Health Services Manager at Occupational Therapy Training Program of San Francisco, or OTTP SF. So OTTP SF is a community-based organization. We were formed in 1999, and actually we used to run out of a broom closet at Ida B. Wells High School. We've expanded a lot since then, but we serve children, youth, and young adults ages 3 to 24 through an array of prevention, early intervention, school-based, workforce development, and aftercare services. Um, our community-based services are really focused on trying to meet youth where they're at, including their home, school, community environments. Um, we do everything from assessment to individual psychotherapy, family therapy, um, mental health-based occupational therapy, uh, employment and clinical case management. And we really focus on trying to be hands-on and engaging to really support the youth in trying to accomplish whatever goals they have. Trainees with us have kind of a mix of duties. Even within working with clients, they might be doing everything from supporting co-facilitation of groups to individual psychotherapy to clinical case management. And outside of client work, trainees support development of social groups for clients, identify resources for both clients and staff, and attend a variety of different types of staff meetings that we have. So at OTTP SF, we get referrals from a variety of sources. It kind of depends on the program. We get referrals from DPH, from the San Francisco School District, from specific clinics or schools that we have more personal relationships with. And basically, supervisors of those programs assign the referrals to a clinician who will do the initial assessment. We gather information from the client, family, school, any other collateral folks that might be involved, like other providers, and we do that kind of over the course of a month. Most of our clients are funded via Medi-Cal, so we utilize what's called a CANS assessment, which is a child and adolescent needs and strengths assessment, which it uses like a combination of Likert scaling and narrative-based format to really support the development of a plan of care. The typical caseload for trainees varies a fair amount just because of the nature of community-based work. It sort of depends on what client needs are happening right now and whether or not a trainee would be able to address the needs of referrals that we have coming in, and also the sort of scheduling component, because often trainees they aren't at our agency every day. But ideally, our trainees would do between 1 and 2 groups that they would co-facilitate, typically with an occupational therapist, and they would also have 2 to 3 individual psychotherapy clients. At OTTP, we have 2 different components of supervision. We have individual supervision every week for at least an hour, which would typically be with either myself or our clinical director, Erica Moore, who is also an LCSW. It can be more than an hour if there's additional questions or concerns that come up, and especially in the beginning, there's often a lot more support as trainees are really getting comfortable with what they're doing. And we also have 2 opportunities for group clinical supervision every week. One is an hour-long meeting and the other is an hour and a half, but it gives staff a lot of opportunity to discuss clinical cases and gather resources and really bounce ideas off of each other, which can be super helpful. At OTTP, we kind of have, I would say, 4 different components to training. There's sort of the in-house training that we give to any trainee or new hire that we have. training them on suicide assessment, how to make a CPS report, what constitutes a CPS report, substance use, how to do assessments, that type of thing. A lot of that's done by whoever is supervising the trainee, and some of it's sort of like self-paced videos and things like that. We also have any trainees that come to us do a couple trainings through DPH for Avatar, which is the system that we use for Medi-Cal billing, and for the CANS training, which is the assessment that we use. We also have trainees shadow intakes or sessions with other clinicians at the agency, just because it gives trainees a really helpful opportunity to see how other people do the work and what it actually looks like in practice. And then beyond that, we also just are always sending out emails about just different training opportunities. Right now, mostly online training opportunities, but just through other organizations that are doing similar work and have continuing education that might be relevant for the folks that work with us. One of the things that's really useful for any trainee coming to us is flexibility. We work with a lot of youth and families that have a lot on their plate, and a lot of times there's a lot of scheduling issues that might happen, or resistance and barriers to engagement. Sometimes there's false starts with a client or with a group starting, and it can be important for trainees to be willing to kind of roll with whatever is going on and support whatever the client might need, um, and also just trust that eventually the thing is going to happen. um, a good work ethic is really important, especially with Medi-Cal and things like that. um, there are definitely specific expectations regarding like how quickly things are completed, and we really want to make sure that clients are getting the best support that they can possibly get. um, and let's see, good communication skills are super important. We communicate a lot via email, and interns might be communicating with lots of different folks from different agencies, like schools or other providers, and it's important that they kind of have that ability to communicate with folks in a variety of ways. Um, and then just I think enthusiasm is really important. Like it helps a lot, and kids can kind of tell when somebody's passionate about the work or doesn't actually care that much. So somebody who's just excited to work with young people. There are definitely a few things that can be challenging about working at OTTP. I kind of alluded to some of this in the things that are useful in a trainee succeeding, but sometimes it's a little slow to start. We may not have a case that's really an appropriate fit, or a group may be starting, but then we have to put it off for a variety of reasons. So that can be difficult when somebody is like kind of ready to get going, and sometimes it can make people feel a little nervous about like whether or not they're going to get the experience. We are such a multidisciplinary team. We've got our occupational therapists, we've got our MFTs and MSWs, we have a psychiatric nurse practitioner, we have non-clinical level case managers, and I think it really is a unique way of engaging with youth and families, and I think it provides so many more opportunities to really learn from one another and support youth in a more like holistic way. I think working in partnership with occupational therapists is an amazing opportunity. Um, I think we often think of OT as more like physical skills development, but mental health occupational therapists really focus on like other types of skills building, like building frustration tolerance or building social skills, and it's all very activities based. And I think I think MSWs and MFTs can both learn so much from these types of activities-based modalities, and I think it can only help make people stronger clinicians when they graduate.